All right, I'm Dr. David Dow, and we're here in our rehab area. And I want to give you some quick tips and tricks that you can use to help relieve shoulder pain fast. And these are things you can do at home today that can be helpful to correct that. Now, the first thing I want to show you is your shoulder pain might be related to your posture. And this may be actually part of what's been causing your shoulder problems. So the shoulder hangs right in the middle of the joint. And when your shoulders roll forward like that, that'll cause that bone to hang toward the front of the shoulder, and then it can start to rub up against the bones that are in there, and that can start causing arthritis. And that can start causing bone spurs that lead to more shoulder problems. So one of the quick, simple things you can do is work on just trying to keep your posture in this position so that the shoulder is hanging right in the middle of the joint, and it's not pressing up against the bones anymore and causing that arthritis type of pain. So for a lot of you, it might be related to a posture issue. I'm going to go a slight bit deeper with that. What can happen with posture is sometimes your posture can be damaged if you've ever had any type of a concussion or a head or neck injury. Car accidents, falls, sports injuries can do it. And when that happens, or if your stress level gets really high, you can move into what they call a sympathetic posture, and your body will move into that just because of those hormones getting released in your body. The adrenaline, some of the cortisol can start leading to that, which can actually begin to cause the shoulder pain. So it could be just straight up from stress or other things that caused it. So correcting that posture can help you. You can try to make those changes at home. If you're still having trouble with that, we've got some cutting edge techniques of correcting your posture and different devices that we use in our office to do that. Stay tuned for those videos that are out there that show you how to do that. Now I want to show you how to use a lacrosse ball on your shoulder that might help. It's called trigger point therapy. It might reduce some of that shoulder pain right away. So now I'm going to show you how to use a lacrosse ball to help reduce the pain. Now we have muscles around our shoulder that are called our rotator cuff muscles, and on the back of the shoulder there's one called the infraspinatus, and when you're working with your arms out in front of you, that makes that muscle contract, and sometimes it'll spasm and get really tight, and that can refer pain to the front of the shoulder. Sometimes when it gets really bad, it'll refer all the way down the arm, and that's how we can tell how bad that problem has gotten in there. But what you can do is the point that we're looking for is on the back of the shoulder, right back in here. And what you're going to do is, I'm going to show this on my left shoulder. The ball is going to go on the wall like this, and then you're going to get your shoulder, you're going to slide your body so that the ball is on that part of the shoulder. You got to search around and look for an area that's kind of tender. Once you find that spot, you're going to lean your weight into the ball, relax your arm, let it dangle, and you want to hold it there for at least 10 seconds. You're probably going to be shooting for about 30 seconds. Don't go longer than, say, 45 seconds. Otherwise, you're cutting off the blood flow, and that can lead to a buildup of lactic acid. So if you want to do this for, say, 30 seconds or so, then after you're done, then you can move to another spot, or you can give it a second for the blood to flow back in there, and then do it again. And you can feel safe to do this as many times as you want during the day. Now, this is not fixing the cause of the problem. It's giving you a relief of the symptoms. I would encourage you strongly to find the cause of the problem so it doesn't get worse over time, because problems that are ignored always tend to get worse over time. So this is one of the things that we can do. And let me show you one more. Okay, so now I'm going to show you an exercise that I call the door hanging exercise. And when the muscles in the rotator cuff get really tight because maybe that rounded shoulder posture has gotten in there, it's been there for too long, I find that this exercise can be really helpful. This can be good for people that have dislocated their shoulders or have those rotator cuff problems. And you want to start slow and kind of work your way up. So it's also great for frozen shoulder. So if you have any of those types of problems, this can be really helpful. So what you want to do is you're going to start from the door frame here, and you're going to take your hand and you can start really low, and you want to make sure that your feet are touching the door frame and are parallel, and then you're going to drop your knees down and then you're going to move your body to the left, shift your hips to the side while you're dropping your body toward the floor. And then you're going to feel that underneath here and maybe into the shoulder a little bit. Now, if you have more, if you're taller or if you have more flexibility, come up to the top of the door. That's going to allow you to hang down even more. Bend your knees, let your hips shift to the left. Keep your body parallel to the door. So don't let your body turn out like this. Keep your shoulders parallel. Bend down and go to the side and let your body hang. Now that's an exercise you're going to get better and better with over time. Eventually, if you have a pull-up bar at home, you can get to the point where you can practice just hanging from the pull-up bar. It's wonderful for your shoulders. It opens up the joints, helps to even realign some of the upper spine, and is a great thing to do. Now, if you're getting problems with the shoulder issues, and it's more than you can deal with, maybe you've lost some cartilage in there, maybe you've already got some bone spurs that are causing issues, and you wanted to see some ways of how we correct that in our office, stay tuned for those videos. Go to our YouTube site and you'll be able to see all those that are there as well. So we use stem cell injections, and we've got ways of correcting the posture. We've got adjusting techniques that will get the pressure off the nerve. We've got acupuncture that we can do to relax the tight muscles and increase the blood flow. And stay tuned for those videos, and or check the box to schedule an appointment to come in our office, and we'd love to see you. Thank you very much.